A meniscus tear is one of the most common knee injuries, affecting individuals of all ages and activity levels. The meniscus is a crescent-shaped piece of cartilage in the knee that acts as a cushion between the femur thigh bone and the tibia shin bone. It plays a crucial role in distributing weight, absorbing shock, and stabilizing the knee joint during movement. Each knee has two menisci, the medial meniscus on the inner side of the knee and the lateral meniscus on the outer side. A tear in the meniscus can significantly impact knee function, causing pain, swelling, stiffness, and limited mobility. Meniscus tears can occur due to a variety of reasons, including traumatic injuries and degenerative changes. In younger individuals and athletes, meniscus tears are often the result of sudden twisting movements, direct blows to the knee, or rapid changes in direction. These injuries are common in sports such as soccer, basketball, football, and skiing, where knee rotation and impact forces are frequent. In older adults, meniscus tears are more likely to develop gradually due to the natural wear and tear of the cartilage over time. Degenerative meniscus tears occur as the cartilage weakens and becomes less resilient, making it more susceptible to tearing, even with minimal force or routine movements like squatting or kneeling. Meniscus tears can vary in severity and pattern. The classification of meniscus tears is based on their location and shape, including radial tears, horizontal tears, longitudinal tears, flap tears, and buckethandle tears. Radial tears are the most common and occur perpendicular to the meniscus fibers, often affecting the vascular supply and limiting the healing potential. Horizontal tears split the meniscus into upper and lower layers, frequently associated with degenerative changes. Longitudinal tears run along the length of the meniscus and can progress into buckethandle tears, where a portion of the meniscus flips into the joint space, causing locking of the knee. Flap tears create an irregular, displaced fragment of cartilage that can cause catching and discomfort during knee movement. Symptoms of a meniscus tear depend on the severity and location of the injury. Many individuals experience sharp or intermittent pain localized along the joint line of the knee, which may worsen with activity. Swelling commonly develops within a few hours to a day after injury, due to inflammation and fluid accumulation. Stiffness and reduced range of motion can make bending and straightening the knee difficult. Some individuals report a sensation of the knee locking, catching, or giving way, particularly if a torn fragment interferes with joint mechanics. In chronic cases, recurrent swelling and persistent discomfort may limit daily activities, such as walking, climbing stairs, or kneeling. Diagnosing a meniscus tear involves a combination of clinical evaluation and imaging studies. A healthcare provider typically begins with a detailed history of the injury, including the mechanism of onset, symptoms, and aggravating factors. A physical examination helps assess joint stability, range of motion, and tenderness along the meniscus. Special tests, such as McMurray's test and Apley's compression tests, are commonly performed to identify pain or clicking associated with meniscal pathology. Imaging studies, such as X-rays, are used to rule out fractures or other bony abnormalities, while magnetic resonance imaging (MRI) provides detailed visualization of the meniscus, confirming the presence, location, and severity of a tear. Treatment for a meniscus tear depends on factors such as the type of tear, its location, the patient's age, activity level, and symptom. Conservative management is often the first line of treatment, particularly for small, stable tears or degenerative meniscus injuries. The RICE protocol rest ice, compression, and elevation is commonly recommended to reduce pain and swelling. Nonsteroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen or naproxen, can help alleviate pain and inflammation. Physical therapy plays a crucial role in restoring knee function, with exercises focusing on strengthening the quadriceps, hamstrings, and hip muscles to improve stability and support the joint. Balance and proprioception training are also incorporated to enhance coordination and prevent further injury. In cases where symptoms persist or the tear interferes with knee function, surgical intervention may be necessary. Arthroscopic surgery is the most common procedure for treating meniscus tears. During this minimally invasive procedure, a small camera, arthroscope, and surgical instruments are inserted through tiny incisions in the knee. Depending on the nature of the tear, the surgeon may perform a partial meniscectomy, where the damaged portion of the meniscus is trimmed and removed, or a meniscus repair, where the torn edges are sutured together to allow healing. Meniscus repair is typically recommended for tears located in the vascularized outer third of the meniscus, known as the red zone, where the blood supply supports healing. However, repairs require a longer recovery time compared to meniscectomy. Postoperative rehabilitation is essential for optimal recovery following meniscus surgery. Patients who undergo a meniscectomy generally have a quicker recovery timeline, often resuming daily activities within a few weeks. In contrast, those undergoing meniscus repair require a more prolonged rehabilitation process, including a period of restricted weight-bearing and bracing to protect the repaired tissue. Physical therapy focuses on restoring knee mobility, muscle strength, and joint stability through progressive exercises. Return to sports and high-impact activities is typically gradual, with full recovery taking several months depending on the type of surgery performed. Long-term prognosis after a meniscus tear varies depending on the severity of the injury, the treatment approach, and adherence to rehabilitation protocols. While many individuals recover well with appropriate management, some may develop post-traumatic osteoarthritis over time, particularly if the tear was associated with significant cartilage damage or joint instability. Factors such as maintaining a healthy weight, engaging in regular exercise, and avoiding excessive knee strain can help preserve joint health and reduce the risk of future knee problems. Preventing meniscus tears involves a combination of strength training, flexibility exercises, and proper movement mechanics.
Strengthening the muscles around the knee,
including the quadriceps, hamstrings, and hip stabilizers, provides better joint support and reduces stress on the meniscus. Performing dynamic warm-ups before physical activity and incorporating stretching exercises can improve flexibility and reduce the risk of sudden injuries. Using proper techniques when squatting, jumping, or changing directions can help protect the knee joint. Athletes and individuals involved in high-impact sports should wear appropriate footwear and consider using knee braces or taping techniques for additional stability. Research on meniscus injuries continues to evolve, with advancements in regenerative medicine, biologic therapies, and tissue engineering offering new possibilities for treatment. Platelet-rich plasma (PRP) injections, stem cell therapy, and bioengineered scaffolds are being explored as potential methods to enhance meniscus healing and cartilage regeneration. Additionally, improvements in surgical techniques and rehabilitation protocols aim to optimize recovery outcomes and minimize long-term complications. Meniscus tears are a common knee injury that can significantly impact mobility and function. Early diagnosis and appropriate treatment are essential for preventing further joint damage and optimizing recovery, while conservative management is effective for many cases. Surgical intervention may be necessary for more severe tears that compromise knee stability. With proper rehabilitation and preventive strategies, individuals can regain knee function and reduce the risk of future injuries, allowing them to maintain an active and healthy lifestyle. Understanding the role of the meniscus, the mechanisms of injury, and the available treatment options empowers individuals to make informed decisions regarding their knee health and long-term well-being.